Dr. Novikov, if every administrator could change one thing about their wound care program tomorrow, what would you recommend?
Wounds kind of get shifted from the administrator's desk very, very fast towards, oh, this is a clinical, and I'm not a clinical person. I am making sure that the building runs well as a business, as financially, so we can continue opening doors to vulnerable elderly patients. The legal risks of pressure sores is significant. The risk of losing Medicare star rating is pretty significant from the wounds. So something that we are starting to collaborate with administrators more, and I wish every administrator spent a little bit more time learning about the wound care and not just outsourcing it to a clinical team.